Today I'm dealing about first aid. Okay, what is the first aid? First aid is taken by immediately after an accident happen. Okay, so it on idea cure, but in order to prevent further harm being done, it's usually for available for human and material resources at the site. So, accident to provide initial care and victim of injuries and sudden illness until more advanced care they provide. Okay, so mainly the three objectives to preserve life and preventive of the victim condition from the worsening and promote to recovery. What are the goals? So, in first class, already seen light first aids classes regarding. Okay, so restore the maintain vital functions. So ABC is a basic support, it's always need. Then airway must be air containing oxygen enter to the body. Breathing is must place oxygen pace through the lungs to the bloodstream and circulate to the oxygen carrying blade to prevent further injuries and deteriorations. Then reassure the victim and make him to comfortable as soon as possible. So what are the first aid kit will be there? Cotton wool, tap, grip bandage, sterile dressing, bandage, thermometer, scissor, gloves, soap, and pain reliever, antacid, ORS packs. So action means if sudden someone is unconscious means we can check for Doctor ABC. Doctor means first danger to you, to others, to victim. So who we can check? Response means victim unconscious or unconscious. Okay, then airway. For airway were clear or objective or open airway. Breathe means chest rising or falling we can check, and we can check the victim breathe and feel the breathe on your cheek. Circulation means feel the pulse, then see any obvious signs of life. Okay, so this is the Dr. ABC methods. Okay, so danger means are you casualty in danger? It's not safe approach to casualty. Then response means that casualty response common to general verb. Airway we can check. Then breathing we can check. So fainting or losing unconsciousness. Fainting it's normally will happen to sometimes hypoglycemic with the patient getting fasting that time and fainting we can check. So fainting is a brief loss of consciousness. So it's a result to interference of the function of the brain. So it's common unconscious. Most common is fainting, head injury, epilepsy, stroke, and poisoning. Diabetes. It's a lack of oxygen. It will be happen for fainting. So when fainting, don't do this. Okay, don't give patient anything to eat or drink. Don't allow the person who has fainted to get up until the victim full consciousness. So the area is warm. Don't crowd on the victim side. Okay. Do catch the person before falls. Pinch the person she moves open or your eyes or not. Okay. Examine the injuries causes unconscious. Little till head back and keep the arms right angle to the body and raise the leg 8 to 10 inches to promote the blood supplies. So loosen that any tight cloths. Keep the warm and cold outside and keep record casualty conditions. So this is a fainting and CPRs. Then burns. If you burn, it will be happen to directly. Okay, so the burn damage to the skin it's caused by contact with the dry heat. It may be caused on fire, flame, steam, hot liquids, hot meat, then sunlight, electricity, and chemicals. The degree burn various. Okay, so first degree what will happen? It will be involved to the top layer of the skin and red and dry. Right, the burn it's generally painful. The area may be swell. The most burns is the first degree burns will be happen. So second degree means involve the both epidermis or dermis. The area is a red and blister may be open and making the skin appear wet. It's a type burns usually painful the area the swelling. So third degree is distort the both layers and muscles and bone blood vessels and all visible. Okay, so this is the third degree. What immediate want to do means immediately that burn area cool water to apply the soaked cold water. Then remove the jewelries and any silver items and all. Okay. Then cover the area with dry sterile dressing or cotton, not cotton or full fly materials, and drop cover to the cat free from the person with blanket immediately. Don't place the burn under the extreme water pressure. Don't remove the cloth that's stuck into the blunt area. Then don't apply the butter almond. All eyes and area is affected. Okay. So then forest bite. Forest bite means is a some honeybee like this and all. It's bited means what will get. So bite occurs to the when body tissue freeze or exposed to the below zero temperatures. What are the symptoms means wax looking skin and firm to the touch, but the tissue is underneath. It's a feel soft and pain allowed the numbness. Dose means cover the frostbitten toes and ears with warm hands. The area is affected can be warmed by the breathing on the placing, then warm area. The body is tipping to the affected to the warm water to 40 degree, then cover the area affected. They do not means that do not rub the ice crystals. It may be damaged. Okay, never rub snow the area. Maybe it's called freezing. Don't apply the direct heat. So rewarm area too quickly. So don't let be the patient walk and don't break the blisters and all. Okay, so bleeding means any cut, scraps and puncture can result bleeding. So severe bleeding, it's a life threatening condition. So that time what we can do means direct pressure elevation to the victim of the patient. Then the patient gets any thicker or bleeding means few minutes it's called clotting will be happen. So that clotting means before we can do first some bandage to done to stop the bleeding or give some pressures. Okay, so after we can give TT injections and all. So what are the warning means if a bleeding is limp means does not stop, apply the pressure with hand and pressure points. Okay, so what are the pressure point we know first we can find. If you are taking ABG we can give the artery pressures. So here emptied object wound apply pressure either side or wound is placed around the before bandaging. Wear gloves it's possible guard against infection. Okay, then electrocution means it's a electricity can be very dangerous unless use the care. Okay, so when accidentally occur to the electricity, first aid must remember it's not safe to the touch casualty with the power has been be turned off. What are the symptoms will be there means it's a internal burn will be there and breathing heartbeat stopped. The patient to treat the person to electrocuted and cut off the power, then remove the victim to the source of the area. Then we can start Dr. ABC. Okay, so snake bite. So most of the snakes is harmless and snake bite generally occur on the limbs. So we can what we can do it's a venous so venous or non-venous we can find. Okay, snake bite must be treated to immobilization of bandage. What are the we can do means keep the bitten limb below level of the heart, affected the bleed for 15 to 30 minutes to freeze freely. Then bite on the limb, apply the bandage inches away from the wound, then wash the affected area with the soap or disinfected solution. Then bandage should not be loose enough finger to slip through the constantly check airway, breathing, blood circulation, start restitution. So if we need see there will no wounds means okay. If any mouth victim is there, we can inform. Then suck it out, but don't not swallow. Split the venom out, rinse your mouth afterwards. Shift the patient immediately to the hospital and rest during transport. Okay, then instruct person avoid to all movement affected area. This is if you happen anything we can do like this only. So fracture and spines. So fracture and spine it's affected the skeleton and can be caused by application of a direct or indirect force. So if your pain it's near near the site of injury means increased by movement. The movement may be difficult or impossible. So swelling and the later bruising of the injury part. So deformity is on the site of the fracture and soak may occur will be there. So what are the do's means check the danger and response, airway breathing and blood circulation of the victim. So airway always control the severe bleeding and immobilization of the fracture. So place the sufficient padding to support the fracture site and immobilize of the fracture sites. So do not force the bone back into the wound. Give proper padding and before the patient to shift to the hospital. Then apply the hospital to reduce the pain and prevent shock. So this is the fracture. It's a closed fracture, open fracture, and usually open. It's a normal. Okay. Then poisoning. Poisoning is any substance which cause injury or illness, death. Maybe introduced to the death. Okay. So here injected poison introduced through the mouth to eating the drink poisoning substance. So inhale poison introduced to the lungs to inhaling. It's any gas forms, the chemical verbs like and all. So observe poison means any typical apply that typically it will be formed. Okay. Then dose, check the danger and response and Dr. ABC. Give milk or water to dilute down the poisoning and monitor the vitals and prevent shock. Observe the amount of color of vomiting. Check the foreign any material to the mouth it's coming or not. Then place the patient to recovery position and wait for the medical assistance and send for to the hospital. Do not introduce the vomiting. Okay. So hot stroke means suddenly very little warning that body is cooling system fails, the body temperature is rise the fast, it's create emergency conditions. So here lower body temperature by the removing and loosening cloth, it's a framing the person and put ice or cold compress to the neck. Okay. Drink lot of fluid. So who is preserve you that more should drink as much fluid as soon as stay away from the place to the that hot. Okay. Then ORS. ORS means it's a lifesaver cases for dehydration. It's a salt and water into the body. It's a dissolve the all the problem. Pinch of the salt into the glass of the water. It's added should be just enough the water and taste like types and tablespoon sugar. It ORS helps to restoring the back electrolyte balance its body or heat rehydrates. So dog bite. So first aid cases dog bite prevent the rabies and reduce the risk of infection to the medical condition as soon as possible. Survive the saliva area away from the wound for clean cloth and handkerchief. Then do not come into contact with the saliva that gets wiped to away. Wash the wound thoroughly to plenty of soap or water. Cover the wound and dry and sterile dressing. Get the medical. Then send the hospital as soon possible. Okay, this is the normal first aid measures of the treatment.